So one of the first things we do with patients when they come in is blood work, labs, right? So I want to know exactly what's happening with this patient. So patients are going to come in and talk about their symptoms, so we can't just guess, right? So we order labs first, and then we want to make sure that the labs correlate with the symptomology. A lot of people have gut dysbiosis or IBS, right? So we want to know, without just popping in probiotics, I want to understand your sensitivities, for example. Do you have sensitivities? Are you sensitive to gluten or dairy? More of a deep dive to find out exactly what's happening with the gut. And the gastrointestinal tract is fascinating. 70% of your immune system is in your gut. So I want to understand what they can digest, what's happening with the intestinal wall, right? So if you have intestinal permeability, also called leaky gut, we want to know. And then when that's resolved, we want to know about absorption. So if you have anemia, or you've had it for years, a lot of times you have a poorly functioning gut as well. So now I can give you, or a practitioner can just give you iron that you take every day to help with iron levels or an iron infusion, but that does nothing for your absorption. It still means you're eating meat, like steak or a leafy vegetable, spinach, and your body is not able to absorb the iron from that. So we want to do a deep dive, again, blood work, to figure out exactly what's happening with your GI. So we can't make the right decisions until we get a clear picture of what's happening inside. And this is why we do this comprehensive panel and even cancer markers. We look at everything just so we understand what's happening with the patient before we make these critical decisions.